Okay, aloha everyone. Good evening. We want to welcome you again to the Queen's Free Speaking of Health lecture series. Tonight's lecture is called Mental Health 101. My name is Shawnee Barr from the Corporate Communications Department here at the Queen's Health Systems. So our presenter this evening is Dr. Sarah Hack. Dr. Hack is an assistant professor of psychiatry at the University of Hawaii John A. Burns School of Medicine. She completed her medical degree at the University of Michigan Medical School, her Master of Public Health at the Johns Hopkins Bloomberg School of Public Health, and her Psychiatry Residency and Integrated Care Fellowship at the University of Washington School of Medicine. Dr. Hack's clinical interests focus on integrated care, which is bridging primary care and behavioral health service to enable easier access and team-based approaches to mental health services for patients. She is currently a psychiatric consultant within several established and newly developed integrated care programs throughout Hawaii and the Pacific Basin. So let's give a warm welcome to Dr. Sarah Hack, our presenter for this evening.
Thank you all for coming tonight and for having me. I'm excited to be here. And so my goal tonight is to do a whirlwind tour of mental health. There's a lot of different directions we can go, a lot of different things to say. So we're going to scratch the surface of some different, I think, important points. And hopefully afterwards in some questions we can get deeper into some areas as well. So, well, before we begin, we're going to go through the basics. So some stats, definitions, things like that. We'll go through some of the common impacts for individuals and societies related to compromised mental health. We're going to touch on some common mental illnesses, and then we're going to try to spend some minutes on what to do to help out to optimize mental health and to deal with mental illness, and then some personal and professional supports that can help if you are having, or someone you know is having mental health struggles. So, the basics. I think we should start out by defining what we mean by mental health. So I'd like you to turn to your neighbor, whether you know them or not, and just take a minute to say, what is mental health? How would you define mental health? Go ahead. Okay. Well, so hopefully that kind of started the gears thinking about it. I think there's many different ways you can go with a definition and different facets to mental health. Let's go to the World Health Organization's definition. So they define mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. I like this definition because it's about wellness and it's about overall well-being, and I think it's really hard to be the full people that we want to be and reach the goals that we have in our lives if our mental health is compromised. So I know as, I can say as a doctor, oftentimes we focus on illness and kind of preventing or, curing illness. But I think that we need to not only think about like creating an absence of mental illness, but also a presence of overall mental health and well-being. So that's kind of how I'd like you to frame this talk. We will talk about mental illness and its consequences and so on, but it's broader than that as well. So kind of taking that concept, I'd like to see mental health and wellness as a spectrum. So here's one way to conceptualize that. On the left-hand side, am I on the right side with, yep. So on the left-hand side, we have healthy, all the way over to crisis, with healthy, stressed, struggling to crisis. And I think if you think about this spectrum, I think all of us can identify a time or a place in our life where we've been at every point on this spectrum. It's dynamic. We can go from one to another. There's some things that I think are within our control that can help move us towards that healthy end of the spectrum, and we'll talk about some of those things in a bit. And there's also some things outside of our control, tragic events that happen to us or stressors that we weren't expecting. But I like this concept of a spectrum. I think it's more accurate than the black and white, illness or no illness. So with that said, I do want to give a few stats about mental illness to kind of give us all similar reference points. So here's a few things to think about. Overall, mental illness is common. It affects almost 1 in 5 adults in any given year. And depending on which statistics you're looking at, the lifetime prevalence, meaning the amount of people who will have a mental illness at some point in their life, is anywhere from about 30 to 46%. That's about 1 in 3 up to 1 in 2 almost adults. The bulk of mental illnesses that people suffer from are depression, anxiety, and substance use disorders. But there are a lot of others as well. Mental illness does not only affect adults, it can affect adolescents as well, and sometimes even kids. About 1 in 10 adolescents will have a major depressive episode or a major depressive disorder in any given year. And when we look to substance use disorders, these are also fairly common. Combining adolescents and adults, about 1 in 12 of these individuals will have a substance use issue, so a struggle with alcohol or drugs in any given year. Okay, so what is the impact of compromised mental health or mental illness? There's impacts on individuals, and then there's impacts on the group and society more broadly. Let's start with some individual impacts. There's a few areas I like to think about. So first, decreased daily functioning. And in fact, for a lot of mental illnesses, this is actually part of the definition. The mental illness needs to cause increased difficulty in carrying out the daily activities or decreased ability to do them. So you're doing all the things that we need to, or we feel we need to do in a day, physical activity, eating, seeing family, seeing friends, doing our work or school, things like that. These can be hard enough when we're feeling mentally well. If you're having a lot of depressive thoughts or anxious thoughts or hearing voices, it can be even harder to do those daily activities. So I think we can see how mental illness can lead to decreased daily functioning. Compromised mental health can also lead to difficulties with physical health. In fact, we know that there's a very bidirectional relationship. We can't really separate mind and body. It's a false separation. We know that illnesses like depression make one more likely to develop or have worse diabetes and cardiovascular issues, and vice versa. If you have diabetes or cardiovascular issues, you're at higher risk for developing a mental health condition. So they're connected. Another impact can be disability. When functioning is so hard that you're unable to go to work at all or go to school or whatever it is, that's really a life changer. And then another very tragic impact can be suicide. Not all suicides happen in someone who has mental illness, but mental illness is a risk factor for suicide, and a lot of suicides do happen in that context. Suicide is on the rise, unfortunately, in a lot of different groups and a lot of different places. You may have seen this in the news. So it's something I know we in the mental health community are really paying a lot of attention to. Looking at suicide a little more closely, this is from the CDC. It's the 10 leading causes of death by age group in 2017. The rows going down are the top 10 causes of death, and the columns going across are age groups. Suicide is in green. I don't know if you can read it, but the suicide boxes are in green. What this says essentially is that suicide is the second leading cause of death in 10 to 34-year-olds, and it's the fourth leading cause of death in 35 to 54-year-olds. So, while suicide is still statistically not nearly as common as depression or anxiety or, many mental health conditions. It's a very serious, tragic, and irreversible outcome. So I think it's something to pay attention to. There's also impacts on groups, societies, and communities from mental health struggles. So there's impacts on families and loved ones. I think mental illness doesn't only affect the individual, it affects everyone in their sphere, right? It affects how they interact with them, how able they are to participate in, family life or social life. And a lot of times families feel a lot of empathy or wonder how they can help someone if they know they're struggling from mental illness. Mental illness can affect schools. It can affect, if a child has mental illness, their classmates, their teacher, the classroom setting. And as we kind of mentioned earlier, it can affect workplaces. So some people, when they're really struggling with mental illness, may not be able to attend work, or if they do attend work, they may be a lot less productive. That's called presenteeism. That can lead to some monetary costs. So that's one monetary cost, decreased productivity or workplace productivity. There's also other monetary costs associated with mental illness. So there's the direct healthcare cost, but then remember there's also that relationship with physical health. So people with mental health issues are more likely to have higher physical healthcare costs because, again, when you're dealing with both kinds of conditions, it can make it harder to get all the conditions under control in some situations. And then another monetary cost, again, is disability. This is a graphic from a UN publication that says that depression is now the leading cause of disability worldwide. And I believe that was as of 2016. So very large financial, emotional, societal, and individual impacts with mental illness. Okay, so let's talk briefly about some common illnesses. So first, this will be another turn to your neighbor thing. I'd like you to answer, who gets mental illness? Okay. Good. I hear some discussion about it. Well, whoever you said, you're not wrong. So anyone can get mental illness. It cuts across all ages, all demographic groups, genders, socioeconomic statuses, professions. Mental illness can affect all walks of life. So that's the main thing I want you to take away. Is that, it can affect all of us. And certainly, statistically, there are people in this room who have been affected by mental illness. It affects all of us. With that said, there are some risk factors that can put you at higher risk for developing a mental illness. Let me talk briefly about those. So there's some demographic risk factors. It depends on the type of mental illness, but most mental illnesses, the majority of them, start in adolescence or by young adulthood. With that said, mental illnesses can start later in life, but young adulthood is a common time for them. There's also some gender differences. So depression and anxiety are more common in women than men, but they're such common disorders that there are many women and men with them. Substance use disorders or struggles with alcohol and drugs are more common in men than women, but again, occur in all genders. Biology is also a part of it. If you have especially a first-degree relative, like a parent with mental illness who's biologically related to you, that puts you at higher risk for developing a mental illness. There's just a genetic component to many different mental illnesses. With that said, environment also matters. So adverse childhood events put you at higher risk for mental illness. Adverse childhood events are essentially traumas in childhood. So neglect or abuse in childhood, witnessing violence in childhood, or having a death by suicide of a family member in childhood, all those would be adverse childhood events. We know that the more adverse childhood events one has had, the higher their risk is later in life for mental illness. Social determinants of health are also a cluster of factors that influence risk. So social determinants of health are essentially the conditions in which we're born, grow, work, live, and play in. So they're things like employment conditions, they're things like one's place in society, how well society does or doesn't accept them, so things like gender, race, immigrant status, sexual orientation, all those things may influence someone's acceptance in society. And there are things like access to health care or lack thereof. Those would all fall under the umbrella of social determinants of health. Stigma can also affect mental health detection and treatment. If you're in a community or a group where there's a lot of stigma against mental illness, it may be harder to both be identified or identify yourself that you have a mental illness, and then to get treatment for it. So, with that said, I'm going to talk about just a couple or three common different mental illness kind of clusters. So first is depression. There's different depressive disorders. The most common is major depressive disorder. So let me run through the criteria for this. And this, like pretty much every mental illness, again, has that qualification that the symptoms of the disorder or the mental health struggles are leading to a change in functioning. That's critical for kind of that illness threshold. There's two core symptoms of major depressive disorder. Some people have one, some people have both. The first one is a down, sad, or depressed mood that's pretty persistent and at least 2 weeks. The second symptom is something we call anhedonia, or it's a loss of interest or pleasure in activities or people that used to be enjoyable. So it's that withdrawing from daily activities and things that one used to engage in. In addition to that, major depressive disorder means that you have other aspects of your life that are affected. So changes in appetite or eating, changes in sleep, changes in concentration, changes in energy, maybe thoughts of suicide. Overall, to meet the threshold for major depressive disorder, one needs to have 5 total symptoms out of these. With that said, depression comes in a lot of different combinations, and even if you don't technically have major depressive disorder, there's other depressive disorders one may have. Another one is called persistent depressive disorder, which is essentially 2 years or more of a pretty down, depressed mood, but it's not leading to all the symptoms up here. Anxiety disorders are also common. One of the very common ones is generalized anxiety disorder. This is essentially worrying too much about too many things, too intensely and too often, to the point that it's getting in the way of your daily activities and kind of controlling your thoughts in life. Social anxiety disorder is anxiety that really focuses on social interactions, and people with social anxiety struggles often are very fearful or having a lot of thoughts that others are judging them when they're interacting with them. And then panic disorder essentially involves frequent panic attacks that one fears. So a panic attack is a very abrupt onset of anxiety that's felt very physically, oftentimes comes out of the blue. And once you have panic attacks, oftentimes people will start to fear new ones coming on, so they'll do behaviors to kind of avoid them, and that can kind of lead to panic disorder. Again, there's other anxiety disorders not listed up here. We're just kind of doing a whirlwind tour of some common ones. The other cluster of disorders I want to mention are substance use disorders. So, if one has a substance use disorder, essentially they're struggling with alcohol or drugs to the point that it's really impacting different areas of their life, and we'll talk about some of these different ways it can. With that said, there's also a group of people who would be what we would characterize as having substance misuse or at-risk use. So it means that they're using alcohol or drugs in a way that is not yet causing a lot of negative impacts on their life, but they're using it in a way that puts them at high risk for kind of developing negative consequences of the use. We'll come back to that in just a minute. But to talk about substance use disorder a little more, there's 3 kind of common features of the symptoms. One would be kind of difficulties with controlling use, so using more alcohol or drugs than you intend, or having trouble stopping when you intend to. problems in daily life. So having the use get in the way of your work, your school, your family obligations, causing arguments in relationships, things like that. And then physical impacts. So putting yourself or others in physical harm because of your use, having withdrawal symptoms if you stop using it, having cravings, having tolerance, meaning that you need to use more in order to get the same effect that you used to get with the substance. So those would be some of the features of a substance use disorder. On the right here, you can see the low-risk drinking limits, and this is kind of getting back to the at-risk use. And I really like this, because there's a lot of people who are in this category. This right here shows what we found in studies, that if you stay below these limits, you're at much less of a risk of developing a substance use disorder or physical issues like liver or heart issues because of alcohol. It doesn't mean if you're above the limits that you are going to develop a use disorder, but it means you're at higher risk. You can see there's a little bit of a gender difference. That's because of differences in metabolism. A couple notes that aren't in the graphic. For anyone over 65, metabolism tends to be slower. So anyone over 65 is actually in that the last category, where the safe limits are no more than 3 drinks on any day and no more than 7 drinks per week. And this generally applies to people who don't have other physical health conditions or other compromising features. If you have some health conditions and things like that, your individual low-risk limits may be different than this. But I like it because it kind of gives a sense of where to start from. Okay, so we mentioned depression, anxiety, and issues with alcohol and drugs. There's many different types of disorders. There's about 20 different types in our diagnostic mental health manual. Here are some of the additional categories of disorders. Just due to time, we won't go through all of them, but I bet you've seen some of these before. Okay, so what to do? I'd like to spend several minutes on this. And some of these what-to-do strategies are applicable for anyone, anywhere in that mental health spectrum, and some may focus more on mental illness, such as medications. But I think, like brief skills, for instance, are really good for anyone, anywhere on that spectrum. Okay, so we're going to talk about brief skills, therapy, medications. Okay, so brief skills. This is kind of a broad category, but essentially, let me kind of explain where this comes from. In psychiatry, there used to be kind of a standpoint that if you were really struggling with mental illness, you needed months to years of therapy to really kind of work out what was happening. Now I think we take a much more nuanced approach in mental health, where we're able to say different people, different problems require different things. And sometimes brief treatment can be helpful. 1 or a few sessions with a professional can kind of get you on your way and be what you need. There's also brief skills that you can do on your own. Let me mention a few brief skills that come up commonly. So the first is behavioral activation. So behavioral activation essentially says, do what you would do if you weren't depressed. Let me explain. So on the left, you can see the vicious cycle of depression. When people are feeling down or depressed, they want to do less. They're going to kind of hibernate, right, on average. So they may pull back from friends and family. They may stop doing hobbies. They may stop exercising or doing anything outside of their must-dos every day. Unfortunately, kind of hibernating like that then can reinforce feeling down, feeling disconnected, feeling a lack of meaning, and that can reinforce feeling depressed. That can be a pretty hard cycle to break. The good news is that there's good evidence that if we essentially engage in meaningful and pleasurable activities, we can eventually come out of that cycle. So doing things like exercising, if that was important to you, reconnecting with family and friends, doing social engagements, picking up hobbies again, all of those things can help get back to feeling better. Sometimes it's pretty immediate, but sometimes it's not. So the key is you don't just do those pleasurable things if you feel like it, because if you're depressed, you typically don't feel like it. You do it anyway with the goal in mind that if you create those patterns and you stick to it, that will help mood, and you will start to feel like it more and more. But it can be a hard pattern to start. So that's behavioral activation in a nutshell. There's also a big category of brief skills that can also take a lifetime to master that would fall under mindfulness. So mindfulness, you can define this or think about it in a lot of ways, but I like to think about it as centering yourself. It's checking in with your brain and your heart and trying to create a stronger connection between your thoughts and your emotions, and trying to do a self-check with where you are internally and how you're feeling. There's different ways to do this. So yoga, meditation can get at this. You can also do a YouTube 5-minute guided video on mindfulness. Deep breathing and progressive muscle relaxation, I would put under that category of mindfulness. And deep breathing is one that I really like and can be helpful in many situations. So I'd like to actually do a little deep breathing now. So it's pretty, you can do it in different ways, but here's a way that I think is pretty straightforward. Essentially, we're going to focus on taking deep, full breaths in all the way from our belly, filling up our lungs. When we get to the top of our breath in, or our inhale, we pause, and then we exhale. It's slowing down and being deliberate with the breath. I like to do it to a count of 5 for me and others, some others that works. You may need to go a little faster or slower, but the goal is to kind of just slow down a little and to be deliberate about it. So we'll do the first one together, and then I'll have you do a few on your own, okay? So the steps are inhale, deep inhale, take a pause, exhale. So inhale, so start now. Inhale, 2, 3, 4, 5, pause, exhale, 1, 2, 3, 4, 5. Okay, and you can slow that down even more if you, it's up to you when you're breathing. But I'd like you to do about 5 of those now. So just take a minute and in your head, do that count and do the progression of inhale, pause, exhale, and then we'll all come back together. Go ahead. Okay, thanks for walking through that with me. So there's different variations. Sometimes breathing, some people like to breathe in through their nose, out through the mouth, but I think we can make it really simple. And the goal should be to be something simple that you can practice for a few minutes each day. It's easier if you practice it when you're calm. It can be used in stressful situations, but it's easier to use in the stressful situations when you're starting to feel keyed up and anxious or sad or whatever it is. If you've already practiced it when you're calm, it's easier to deploy then. So this is one that I really like and can actually be pretty powerful with some practice. Another one that I like, but we won't do for time today, is progressive muscle relaxation. And there's there's things you can read through online, and there's YouTube videos about it, but this is also a really nice mindfulness exercise. The other areas of brief skills that I just want to mention are kind of lifestyle factors. So this is a huge bubble, but focusing on issues like your sleep habits, your activity or exercise habits, your diet habits, things like that. All also affects mental health and wellness. So those can be other areas that one may focus on when they're thinking about kind of brief skills or brief things to add in to achieve mental wellness. Okay. Psychotherapy can also be really helpful. It can be helpful for people with mental illness and also for some people who don't have a bona fide mental illness but are having kind of recurring difficult to figure out problems. I like to think of psychotherapy as essentially it's bringing a professional in to help us get another perspective on problems that we've kind of been struggling with for a while. If this is kind of how problems go, which I think sometimes it is, you're kind of stuck in your head and same solutions keep coming out time after time, it can be really helpful to bring someone else in to get another look at it. What therapy is not, in my opinion and my practice, is they're not advice sessions. So I like to tell my patients, I'm an expert in behavioral health and in therapy, but you're the expert on your own life. So I think our job is to bring our expertise together so that we can figure out a new outlook or new steps forward. But it's really a partnership. It's not the therapist tells you all the answers and you go do them. It really needs to be a more active partnership. There's lots of different individuals and therapists out there, and I think therapy is very much a relationship typically. So, and different therapists practice in different ways. So sometimes it can take a little while to find the right fit. Sometimes the right fit occurs right away. But there's a lot of variations. And there's a lot of different official types of therapy. Two common ones that I wanted to mention are cognitive behavioral therapy and psychodynamic therapy. Cognitive behavioral therapy essentially looks at thoughts, feelings, and behaviors and the patterns between these. When someone gets a better understanding of their patterns between these, they're then more able to make changes to them to get to their goals and to where they want to be. Another type of therapy is psychodynamic therapy. This looks more at kind of uncovering the unconscious kind of motivations or factors behind someone's actions and emotions. And there's hundreds of others probably hundreds that I haven't mentioned, but there's a couple basic ones. So there's also medications. We have a variety of medications that can be effective for people struggling with mental illness. Here's some of the categories of medications. With that said, medications in these categories may not always be used for what the category indicates, and I'll give a few examples. We don't really have time to go in depth on all of them, but I did want to mention a few specifics about antidepressants because those are the most common mental health medications that we use. So a few general tips about antidepressants, or at least most meds within this class. When people start them, sometimes you can get an effect within a week or two, but it really does take up to 8 to 12 weeks at a good solid dose in order to know what the full benefit is going to be. And this may be, for some people, increasing the dose a couple times to get to that right dose. So it's somewhat of a commitment. It's not something you take and you feel better typically that day. Every now and then that happens, but it's really more of letting your body get used to it and acclimate, and then kind of checking in for the effect. Antidepressants are used for depression often, but they're also used for other disorders. So they're often first-line treatment for a lot of anxiety disorders as well. And sometimes I'm asked, well, how long should I be on this med? It really depends. In general, the more significant or more severe a person's history of depression or the more severe symptoms they've had or the more frequent episodes they've had, the longer you may want to think about being on an antidepressant because we know rates of having recurrence of those issues is higher if you're not on the medication. But again, there's a lot of individual variations to this, so the answer is the length kind of depends. So some other classes of medications, again, they're used for different things, but anxiolytics, they may be used for issues with anxiety, but also sometimes with other things. Mood stabilizers, we typically think about those for bipolar disorder. Antipsychotics, Those may be used for someone suffering from schizophrenia or other psychotic issues, but they're also used for things like bipolar disorder sometimes, or to help with depression treatment. And then there's also medications for some substance use disorders. So especially alcohol and opioid or heroin issues, we have medications that can help decrease the amount of use or the frequency of use. For other drug use issues, the medications are still not as established or not as widely used, but there is a lot of research going into it. Okay, so what to do? Brief skills, psychotherapy, medications, those are three big bubbles, and within each, there's a lot there, but hopefully that gives kind of an overview of some different avenues to think about. The last area I want to touch on is who can help. So I would divide this into personal supports, professionals, and resources. So in personal supports, there's family and friends, which are really important. Having people in one's life who they can go to and kind of share their experience is pretty critical. And oftentimes, again, in some mental illnesses, people will kind of draw back and they may want to isolate. So I'll encourage people, I'll reach out and kind of see who's in their life who can be a good support, and I'll encourage them to reconnect with those people. If you're a family or a friend and you want to support someone with mental illness, there's a lot of different resources that you can kind of look to, but a few general things to think about are being non-judgmental and offering the person just a place and an ear to listen to them can be really important. Mental illness can feel pretty isolating and pretty alienating, and sometimes just hearing someone's experience and letting them talk about it is really powerful. Sometimes people want advice, but I find that people get advice much more than they want it. And so, especially with mental illness, some things that generally aren't helpful for most people are, like just get over it or just move on, or, it's not real. Those things are not typically helpful, and they're not typically true, right? People with mental illness, if they could just kind of get over it or, kind of buck up, I think they would, right? So just kind of being that supportive person and just being there to listen and to kind of ask the person, what do you need? How can I help you? Those things can be really powerful. There's also peers and groups that can be helpful. So thinking about groups, so there's support groups, there's groups for people with anxiety or depression or grief, like the loss of a loved one. And there's also groups are a big part of some treatments for alcohol or drug use as well. And then there's also larger groups and organized groups that can also be really good supports. So one example, and they have a table here, would be NAMI, so National Alliance on Mental Illness. This is a national group that has chapters, I believe in every state, but definitely they have a chapter in Hawaii, every state. And their main goal, if I can get it right, is to offer support and education and help for people who are affected by mental illness. So individuals affected and their loved ones. Is that a reasonable description? Okay. Great, okay. There's other mental health support groups as well, but NAMI's a really a big and well-established one to think about. So that's kind of on the peer and personal support end. There's a variety of other of professionals who can help too. I can't fit I would like to specify every single type of individual and professional who helps, but here's some general categories. So one that I think is often overlooked are primary care providers or your family doctor. Family doctors very frequently help out with mild to moderate mental illness. And if they feel like they can't help, they can also typically offer next steps or resources or referrals. So they're really good first stops for people struggling with these issues. There's many different therapist types who come from a variety of background. Most therapists in general have a master's level or a PhD level degree. Some therapists work on specific disorders and with specific populations, like say people with alcohol or drug concerns. And some therapists work to have a more general practice. There's also psychiatrists, so like me. Psychiatrists are medical doctors who focus on mental health, and they typically are MDs or DOs. Psychiatrists, from my standpoint, can help establish diagnoses. Therapists can also help establish diagnoses. Psychiatrists can also help make kind of a comprehensive mental health or mental treatment overview. They can help prescribe medications if indicated. And sometimes, some psychiatrists in certain settings do therapy as well. There's psychiatric APRNs, which stands for Advanced Practice Registered Nurses, and PAs, which is Physician's Assistants. So these individuals focus on psychiatry and mental health. They may help with medications and or therapy and the other features that I mentioned. But they come at it from a different training background, either an advanced nursing background or a physician assistant background. And then there's many other people in professionals who also help, which are kind of grouped under support staff. But there's a lot of other people involved. So these are people who help people obtain resources. So like the social determinants of health, if someone needs help with housing or kind of job retraining, they may connect them with that. They may help coordinate someone's appointments. They may help with doing screenings for different mental health issues in primary care offices. There's a variety of different things that other people are helping in front and behind the scenes. And this picture here is my department's psychiatry and support staff group, so I just wanted to put it up there. Okay, the last area I want to talk about is resources. First, we'll talk about a couple crisis resources, and then we'll talk about some general resources. The National Suicide Prevention Lifeline is a really good 24/7 lifeline for anyone in crisis or having suicidal thoughts. And the number's right there. If you call them and you have an 808 area code, they connect you with the Hawaii-based kind of chapter of this organization, so they can also help with kind of local resources if that's needed. And again, you know, it has suicide in the name, so it's for people who are having suicidal thoughts and crises, but it's also, you don't have to be suicidal to call. You can just be having a crisis of another sort, or be extremely anxious, or whatever it is. They talk with everyone who has mental health needs acutely. If you don't like talking, there's a text line, and this is a little small, but it says text aloha to 741-741. That's the Hawaii text line. And it's the same purpose as the above one, but it's text communication as well, and it's 24/7. And just like the National Suicide Lifeline, it's staffed by trained individuals who their main job is to deal with and help people in crisis and with suicidal thoughts. Other things, if you or a loved one are in a significant crisis, or you're worried that you may hurt someone or yourself, or a loved one may, you can also always call 911 or go to the emergency room too. A few non-crisis resources that I thought were worth mentioning. One is Rethinking Drinking. So this is where I took that low-risk drinking guidelines from. And I really like this website. It's interactive. You can go on it and you can kind of punch in where you are with your drinking, and then it gives you feedback where you are compared to the general population. And it can also help you kind of think through a plan if you decide you do need to make a change to cut down or stop. But it has a lot of useful information. There's also a SAMHSA national helpline, and this is a helpline. It's also 24/7, and its main goal is to help people find mental health referral and resources for mental health or substance use, alcohol, and drug concerns. So that can be a nice place to kind of get plugged in, because it can be really hard, I think, sometimes to find the right professional at the right time. And then the very last thing I wanted to mention was I just wanted to say a word on smartphone apps, because this is something that sometimes I'm asked about. There's so many smartphone apps out there to help with different disorders or different symptoms. It's hard. I'm not familiar with all of them because they keep coming out, but they cover things like issues with anxiety or mood, issues with sleep, how to make a crisis plan if need be and have a crisis plan on your phone, mindfulness apps and things like that. So when patients tell me about the ones they're using, I try to kind of get familiar with them, but there's a lot. I'm mentioning this website right here, Anxiety and Depression Association of America, because they have a section on it where they review different mental health apps. I wasn't familiar with all of the ones that they had, but I was familiar with a fair amount, and I thought it was a pretty solid list. It was some of my go-tos that I sometimes recommend. So if you're looking for a list to start with, that might be a place to look. So there was our whirlwind tour. I think we covered a lot, and I know we could go a lot of different directions, but hopefully that gives a good overview. And I'd love to answer some questions. So hopefully there's some things that came up. And just kind of a general note I'll give. Very open to answering whatever's on your mind. If it's, because this can be a very sensitive topic, please make sure that your question doesn't have a lot, like identifying it for, please respect privacy, you know what I mean? So don't make it too personal about a loved one or something like that. Please try to make it somewhat general if it is something like that. So, okay. Oh, okay.
Oh,
Go ahead.
okay. Thank you. I'm curious on mental health, where this fits, if it does. Every day, people have to make decisions, minor and major. And I feel that where people base their decisions on is what I describe as one's personal belief system, a system of beliefs, ideas, values that they can draw on to make a decision.
Yeah.
So I haven't heard in your presentation any reference to the quality or how one can address or care for one's belief system. In other words, it's like mental health is like thinking of a mental body, like a physical body. So I care for my physical body by, giving it a bath, on a regular basis, the nutrition I put into it, exercise. So with mental health, the mental body and the basis of your decision making being your belief system, shouldn't people be encouraged to develop a skill to understand what their belief systems are, since they make their decisions based on their own personal belief systems?
Yeah, so that's a really good and interesting question. And I think I tend to, so I'll give you my spin on it. I tend to be somewhat of a functional or practical person. So if a belief system, so one question I would ask is the belief system getting you where you want to be? Is it helpful to support your mental and physical health? I don't think that we have, I think one would be hard pressed to say this belief system is better than this one is better. We can't really rank them. We all come from such rich, diverse backgrounds, and there's so many different ways of looking at health, mental health, life's purpose, you know what I mean, depending on who you are and your background. And those beliefs are also evolving over time. So I don't have the same beliefs I had a year ago or 10 years ago, and I'm sure no one else does too, right? We're constantly evolving. When I'm working with people and some of their beliefs, their very strong beliefs seem to really be influencing their daily decisions and their functioning, I may kind of just gently ask or point out, how does this seem to be impacting you? There's a lot of beliefs that seem really reasonable and can help people get to where they want to be. And then there's some that, for that person, if they're not working for the person or they're leading the person to feel stress or guilt or shame or, withdrawing, to me, that might be something to say, not putting a judgment on the belief, but saying, are you where you want to be? So to me, I look a lot at the outcome. But that's a complicated question. Also, a good thing to talk about in therapy, too.
Yeah. Hurt and harm. It's a simple, consequences. So if your decision leads to a consequence that hurts or harms somebody else or yourself, wouldn't that be reasonable at a level of evaluation to determine whether you're on the right track with a certain idea?
I think that's a pretty good golden rule. Yeah, I think something that causes yourself or others hurt or harm, generally, I would be hard pressed to recommend it.
So is
Yeah.
it so complicated that, you know, your profession, why can't there be resources to help people with their decision-making skills? It's like, for example,
I think therapy does. I think therapy really gets at that. But it gets at it. The point of therapy is not to say your belief system is good or bad.
right, no.
But it's to kind of take a deeper dive and to see how it's serving you.
Right, for example, like the debate between monogamy or you know, promiscuity. So if the idea is that, if one idea says that monogamy it's not a right or wrong, but that you can be happier with monogamy, for example.
I think one of the things I love most about the world is that there are so many different people and so many different ways of living, and I think it adds to the richness. And you're right, it's kind of I'm with you. I think it's looking at how it's serving the person and how it's serving the people around them. Yeah.
Okay.
Thanks for the question. Yeah.
Thank you. Next question to the right.
I have a quick question. Where do you draw the line with recommending help for a friend and pushing them?
Yeah. Well, I'm not sure kind of how you would define those terms. I find, again, I try to be pretty practical. I find that, like, kind of pushing help against their desires, it just doesn't often work, to be in my experience. And I think pushing versus recommending can, so I try to take kind of a gentler lead. But I think if you're coming at someone who you have concerns and you're coming in a genuinely concerned and non-judgmental way, I think you can get a pretty strong message across without saying they have to do this, you know. But anyone who's a competent adult, we can't force anyone to get, you know, help that they don't want to get. With the exception, if you think someone is in an acute crisis and may end their life or end someone else's, you can, again, call 911, get the police involved, but that's a very small segment. So I would suggest starting with trying to really hear that person, hear where they're coming from. And then I think if they know you're coming from a caring place, I think it's often appropriate to say, you know, what you're saying sounds very overwhelming, very stressful. I'm having the thought that, you know, getting some more support, some professional support could be really helpful for this. So then maybe you don't need to draw the line between recommending and pushing. I don't know if that answers it, but that's kind of my spin on it. Yeah.
Okay. Anybody else? Question right here on go ahead.
Hi, I have a quick question. So I come from quite a long line of mental illness. What are the best steps that I can take to not fall down that rabbit hole?
Yeah, great question. So I think some of the things that I put under that huge umbrella of brief skills are some of the things I would look at. So I think for anyone, whether you have a strong background of family mental illness or not, those are things like mindfulness and attending to your personal needs and your professional needs and all the different facets that are important and meaningful to you, I think are really important. I think if you're fairly mentally healthy, I think self-reflection can also be really helpful. So knowing for you, what are your kind of warning signs that you're not feeling as healthy or that you may be headed for that stressed or struggling area, and kind of making a plan when you feel healthier about what the warning signs look like and what you can do if they come. So for instance, you know, for me, I know I'm stressed when I am ruminating about work at night, when I'm not working out, and when I'm snapping at my spouse. So those are things that if I'm doing that, I already kind of, when I'm at my top self, I have a plan in place to take a step back and say, okay, I have to go to the gym no matter what, because I know makes me feel good, or whatever it is. So kind of being proactive and having a plan is important. And I think also, if you feel like you're kind of sliding down that slope, I don't think there's ever a wrong time, in my opinion, to get a therapist involved, at least to kind of get another opinion, and to kind of make sure you have a more holistic, comprehensive plan in place. Yeah.
Okay, thank you, Dr.
And then also alcohol and drugs. Alcohol and drugs put us at high risk for a lot of different things. So people with mental illness, oftentimes I'll have a stronger recommendation that they really try to not use them or use them extremely limited. Yeah.
Thank you, Dr. Hack. Appreciate it. I know we have some more questions, but I know we want to get everybody out of here on time. Doctor, we'll stay again here for a few minutes after so you can ask your questions. But again, thank you, Dr. Hack, very much for a very informative presentation. Thank you very much, Doctor.
Thank you. Thanks for your time.
Yeah.
So again, also mahalo to Val Milstein for providing sign language interpretation for this evening. Also thanks to once again, the National Alliance on Mental Illness Hawaii, and the Queens Behavioral Health Department who are in the lobby earlier this evening sharing great information with everyone. And also thank you, Abby, our Queens volunteer. So we want to let you know that usually we have a Speaking of Health in December. We're going to be taking a break because it's the holiday season, so we won't have one in December. You can continue to check our website at www.queens.org and click on classes and events, and you can see what's on tap for January of 2020. That's when we'll be back. So again, thank you for attending tonight's Speaking of Health lecture. Don't forget to get your parking ticket validated in the lobby, drive home safely, and on behalf of the Queens Health Systems, happy Thanksgiving, Merry Christmas, and Happy New Year.